Welcome to the Children's Hospital. We are so pleased that you can join us as we make an exciting announcement that will affect the health of the most ill and critically injured children in Oklahoma and in the region. I'm going to introduce to you our speakers, and following their presentations, you will have an opportunity to tour the new facility and interview our guests. Today, our presenters include John Hayes, the president of the Children's Hospital, Dr. Morris Gassaroon, Chair of Pediatrics at the University of Oklahoma College of Medicine, Rachel Hare, a registered nurse in the Pediatric Intensive Care Unit, and Denise Burns, mother of Fletcher, one of our superstar patients. John, I'm going to hand it over to you so you can tell us why we're here today.
Thanks, Jennifer. Good morning, everyone. Thank you for being here today. After more than 6 years spent in planning and implementation of development and finally construction, today we're excited to announce the opening of the Children's Hospital newly expanded Pediatric Intensive Care Unit, or PICU. We will begin seeing patients in the newly expanded area on Monday, July 22nd, just 3 days from today. The facility represents a $27.5 million investment in improving the quality of care for children throughout the state of Oklahoma and the surrounding region. This 34-bed expansion brings our total PICU capacity to 59 beds, where we can provide state-of-the-art care for seriously ill and injured children ages up to 18 years of age. While this expansion significantly increases the number of available beds, the increased capacity also means more patients receive the care they desperately need from the most skilled providers with great depth of training and experience. Dr. Morris Gassaroon can tell us more about those providers, since he is actually one of them, and how we will be able to impact even more children to receive great care. Dr. Gassaroon?
Well, thank you, John, and good morning, everyone. Having been a pediatric ICU doctor here at Children's for almost 30 years, I think I can speak on behalf of the other ICU doctors, nurses, and staff and say that we are indescribably excited about this new facility. It has been highly anticipated and will dramatically improve our capacity to care for the children of Oklahoma in need of these high-intensity and high-technology services. This Pediatric Intensive Care Unit will be the most modern and technologically advanced PICU in the state, while at the same time being the most family-friendly of any such facility in Oklahoma. Now we're able to fulfill our mission to take care of every child needing this level of care through our combined efforts. From the newborn whose delivery and discharge were routine but became seriously ill, to the infant or toddler with a severe respiratory infection, or the teenager severely injured in an accident, we have every resource to meet these needs and more. Our PICU offers many highly specialized services, some unavailable anywhere else in Oklahoma. These services include board-certified pediatricians with specific expertise in pediatric critical care medicine on-site 24 hours a day, 7 days a week, 365 days a year, supported by the full range of pediatric medical and surgical specialists. Highly trained and experienced nurses, advanced practice providers, and respiratory therapists, child life specialists with specific training for intensive care environments, and advanced technologies such as extracorporeal membrane oxygenation, also called ECMO, a modality that allows for life-saving support for infants and children with severe acute lung or heart failure, renal replacement therapy to similarly support acute kidney failure or other life-threatening metabolic or toxic conditions, bariatric rooms capable of meeting the unique care needs for patients with obesity, and isolation rooms to protect patients whose immunity is compromised, such as from cancer chemotherapy or organ transplant immunosuppression. So now I'm happy to turn the podium over to Rachel Hare, a registered nurse in the PICU, who will talk about the support and care we provide our patients and their families. Rachel.
Hi, everyone.
So just to kind of stem off of what Dr. Gestern was saying, we do definitely provide family-centered care in the PICU. And one of the ways we're able to do that is just by basically having private family areas within our patient rooms. We not only want to take incredible care of our patients, but be able to cater to our families in practical and emotional ways as well. One thing I think was so cool about the designing of this new PICU is that we actually brought a family advisory council in. What they were able to do is just provide us insight, ideas, recommendations on how we can make the PICU better. Some of the things we took away from that are private sleeping areas, places to watch TV, and private bathrooms as well, which I know we're all very excited about. We really want to bring a sense of normalcy to families in such a high state of stress and anxiety, and we're very optimistic that these things will help cater to that. I can speak on behalf of the nursing staff that we're all so excited for this new unit. And speaking of families, we've got Denise Burns here, incredible mother. She'd just like to give her insight on her stay with us. Denise?
Good morning. Thank you for having Fletcher and I today. We're excited to be here. I'm Denise, also known as Fletcher's mom. He is 14. He has a huge personality. He doesn't know a stranger. He loves people. We recently spent 6 weeks here at Children's Hospital, and he spent his days making bracelets out of pipe cleaners and pony beads. And anyone who entered his room got a bracelet. They left with a bracelet. So you can look around this hospital and you can see bracelets on the badges of physicians to the housekeepers. So he's been very well taken care of here. His diagnosis is epidermal nevus syndrome, and he has vitamin D deficient rickets. He also is obviously trach and ventilator dependent. And recently he has pretty serious gastrointestinal issues, and he's been hospitalized 7 times in the last 20 months. He's had 5 major surgeries and dozens of procedures. Whether it was through after a surgery or because of a rapid response called in the middle of the night or the middle of the day for that matter, we ended up in the PICU at least 10 times. We were taken very well care of, not just Fletcher, but as our family. We always felt confident that he would. We're almost done here. Sorry. He doesn't have a whole lot of patience. Like I said, big personality. So anyway, we're so grateful that there are now 34 beds available for kids like Fletcher and that they can receive the care that they need. We hope we're not back here anytime soon, but it's likely because of our issues, right? Do you love it here? Yeah. Do you love the nurses and the doctors? Yeah. So anyway, on behalf of our family, we are grateful and we appreciate everyone here and all that you do. Thank you very much.